lots of women say this, if, you know, I would have died in childbirth if, you know, we weren't there to save you. And maybe, yes, but is that because birth is inherently unsafe and dangerous, or is it because of interventions and what we do to a woman's uterus when we try and get her into labour? Yes, of course, things did go bad and things were unsafe when you didn't have people attending births, but actually, for the majority of people, birth is quite an uneventful process, and it will be a normal physiological process, and your uterus knows that its job is to grow a baby and then to deliver the baby. So when we say, if I wasn't there or if I wasn't in their care, I would have died, was it because birth was is unsafe, or is it because of what we've done? Now, if you've got dangerous blood pressure, obstetric cholestasis, HELP syndrome, a baby with a placenta previa, like a woman with a placenta previa, a cord prolapse, a uterine rupture, scar rupture, then of course those things are like, we can die, women and babies can die through those things, but they happen, but they're not common. So yeah, it can happen during labour and birth. It can also happen during cesareans. But is it like, what came first, the chicken or the egg? If you have a medical condition, then obviously, absolutely, you need to be with midwives and obstetricians to look after you and to deliver your baby safely and to stop bleeding, of course. And that is when we are in a position to save you and or your baby's life. But sometimes we do things that can actually cause a lot of damage and harm. All right, so I'm not saying things don't go wrong. They do. That's why we're medically trained to be able to manage those situations, thank God. But yeah, just a little bit of food for thought there. The list I put there isn't exclusive either. There are lots of other conditions and things that need to be monitored, and lots of very valid reasons for induction. I just wanted to add that.